Hello, welcome to the Grow Your Wealthy Mindset podcast, where it is all about helping amazing physicians just like you create a wealthy life free from burnout and with the financial security to practice medicine on your own terms. I'm your host, Dr. Elisa Zhang. Hi, and welcome back to the Grow Your Wealthy Mindset podcast. I'm so excited for our guest today. We have Dr. Stephanie Pearson, who turned a tragedy in her life into a mission to help other physicians avoid the situation she found herself in. Can you share your story of what happened to you?
Of course. Hi, good afternoon. So I am an OBGYN by training and trained and worked in Philadelphia for my clinical career. And unfortunately, I was kicked in the shoulder during a difficult patient delivery. And unbeknownst to me, she ruined my career. I ended up with a torn labrum in my left shoulder. I was told that it would heal and I'd be back to work in 12 weeks. And unfortunately, I developed a frozen shoulder, had surgery. My surgery didn't go as well as planned, and I have significant range of motion deficits and nerve damage in my left arm. I have not been cleared to do OB or operate, and I have now been medically retired for a little over 8.5 years. And I learned a lot the hard way about disability and life insurance, and have really decided that I really don't want anyone else to have the same issues that I found myself in.
Right, because you actually had disability insurance and thought you had the coverage you needed in case of such a situation.
Yeah. So first, I thought that my group benefit through my hospital would help me, right? Especially because I got hurt at work. And unbeknownst to me in fine print, our group benefit didn't cover work-related injuries. I was flatly denied and told I would have been better off had I fallen off my bike, which is a pretty hard pill to swallow when you think if I hadn't finished the delivery, I'd probably be in court. And while it's not the norm, it's also not uncommon. And we're actually seeing more and more policies that have that language since the start of COVID. But back when it happened to me, I had no idea that that was something that they could write into a policy, right? I mean, we're doing our jobs, we should be covered. And so I did not get any of my group benefit. And then I figured workman's comp would kick in. But they initially declined me as well because they said while an injury occurred, my frozen shoulder was idiopathic or my fault because I continued working, right? Because that's what we do. We put our heads down, we keep working. I figured out how to compensate until I really couldn't. And so I worked for 8 months with the limitation until I realized that I just couldn't get my arm to do what I needed it to do. So that I had to sue for, and that took 14 months, multiple court appearances, at which one, they had the nerve to say I could be a billing secretary because I had the aptitude to learn codes. So not really a position that you want to find yourself in. And I had 2 private policies that my senior partner told me to get when I was a new attending. I actually did not or was not educated as a trainee. And I did what the guy said, right? I mean, we were very trusting. We want our patients to trust us. So I figured this guy had my best interest at hand, and turned out that, like many physicians, I had been a bit bamboozled. I was grossly overinsured for life insurance. I was not only underinsured for disability insurance, but I didn't have all the right pieces. And it was, again, a hard lesson to learn when I needed it. And so I became incredibly passionate about the topic because I figured I couldn't be the only person that this happened to.
And so what was the path between actually suing and being able to get some benefit from workers' comp to where you are now with PearsonRavitz?
So the court case for workman's comp, I actually settled really for my mental well-being. Getting kind of dragged through the mud was not good because I was already dealing with loss of identity and trying to figure out what I was going to do next. And admittedly, I was in a pretty dark place for quite some time. So I settled for workman's comp. It at least gave us a little bit of a cushion to figure out what was next. I did get my private policies, but one of my policies has language called a transitional occupation instead of what we've learned is specialty specific or own occupation. And so there's a cap. And so what it says is I'm considered totally disabled if I can't do my job, regardless if I'm employed in another occupation. But there's an additional phrase that says until I make my pre-existing earnings or pre-disability earnings. So every month I still have to fill out paperwork and send notification to the company with what we're making, what we're not making. And there are certain months where I don't get my full benefit. I've been challenged twice over the last 8.5 years. And it's a never-ending saga, to be quite honest. From there to PearsonRavitz was not a straight line. I started lecturing to area residency programs more for, to be honest, for catharsis, because the more I told my story, the easier it was to tell my story. And because I didn't want them to make mistakes, but I was sending them to Scott Ravitz, who is now my partner, because he's the one who helped me. And we have a weird small world connection. I grew up with his cousins. He's been tailgating at Eagles games with my brothers forever. And I just didn't know that. We were actually brought together by a common friend because my broker was golfing in Florida and really couldn't be bothered when I needed his help. And so I was doing these lectures. I was sending them to Scott. And in the meantime, I was trying to figure something else out. I did some medical editing. I did some biotech consulting. I did some med mal defense work, which I actually really enjoyed, protecting my colleagues. But you have to have seen patients, at least in Pennsylvania. I don't know what the ruling is everywhere else, but in Pennsylvania, in order to be an expert witness, you have to have had clinical practice within 3 years. So I timed out. And then I was like, oh, geez, what do I do now? And at one point, Scott and my husband, two different people, sat me down and said, hey, this is silly. You now know more about disability insurance than 90% of your colleagues. So why don't you get licensed? And honestly, I thought it was the dumbest thing I ever heard. I was like, I'm not a salesperson. I'm a physician. This is ridiculous. And they were both like, right, you're not a salesperson. And that's why this works. And so go get licensed. So I locked myself in a room and studied for a while with, my colored pens and highlighters because I'm old, and took the test, passed, and then cried in my car because I didn't score as high as I wanted to. And my husband laughed at me and said, sweetheart, no one's ever going to ask you if you got an A or not. And that's how it all started. And it actually started at my kitchen table. Initially, it was Stephanie Pearson, MD, because Scott was working for kind of a career agency, and nobody expected this to take off the way that it did. And so maybe a year into me doing it and kind of Scott helping me in the background, we decided it was time to either join forces for real or I was going to do this myself. And he smartly decided to partner up. And PearsonRavitz was started. Actually, we're going to be 5 years old in 4 days. June 26th is our anniversary. And so it's been 5 years. And God, we have 26 full-time employees now, and we have clients in all 50 states. And we're really trying to change the way that insurance is handled for physicians and kind of demystifying what historically has been a confusing topic.
Yeah, when we met at the White Coat Investor Conference, I learned so much more about the nuances that go into just the application process for disability insurance. Can you speak to why it's so important to go to someone like you who can really understand like your past medical history and really interview you properly to get the information before you even go about applying for disability insurance?
Sure. So disability insurance is so nuanced. Life insurance, right? You're looking at mortality risk. You're either alive or you're dead. And we understand, especially as physicians, where kind of mortality risks lie. With disability insurance, it's a little bit different, right? They're looking at what's your morbidity risk? What are the odds that you're not going to be able to do your job, but you might be able to do something else, right? And there are so many things that go into not only getting covered, but how it's priced, what they're going to cover and not going to cover, and understanding kind of what the underwriters are looking for and being able to advocate is really important. And without understanding past medical history and past surgical history and what medications are you taking, right? What ends up happening sometimes is that people find themselves in a position where they're not getting the coverage that they should be getting, or they get declined, right? Because of something that should have been asked up front. There are certain medical conditions that will change the way that your coverage is designed. And I'm all about transparency and understanding and creating realistic expectations. And so understanding kind of going in eyes wide open and realizing, okay, this is what I can get. This may be a limitation. Understanding that up front really sets the stage for the potential outcome. And I can tell you the worst phone calls that I get are people who have gotten declined or have gotten a subpar offer, and then it affects moving forward. And so it's really hard, even for me, to stay up to date. And we're talking about 6 companies, right? It's not a giant playground. There are 6 companies that cater to physicians and offer truly specialty specific coverage. And they change all of the time. And so, we look at financial advisors who are advisors and selling products. I don't understand how they can stay on top of it. It's really important to understand the changing dynamic within the space so that you really know what you're getting.
So if someone wants to get disability insurance, what's the process of what it looks like to work with you?
So we have a intake form that is very reminiscent of your PCP office. So we actually ask upfront, right? What's your past medical history? What's your past surgical history? What medications are you taking? If you're a woman, what's your pregnancy history? What's your delivery history, right? So it takes about 10 or 15 minutes to fill out this form. Then you actually have a real conversation with one of our brokers. And I've taught all of our brokers how to do what we want done. I review all of the intakes that come through so I can lead the conversation. So I get that not all of our brokers are physicians. We do have another disabled physician on staff, but for our non-physicians, I'll put little notes, right? Ask about when was this diagnosed, ask about who's writing the prescription. So it's typically a 45-minute phone call, which I get can seem like a lot and we're all busy, but it's so important that we get all this information up front. We run everybody through all 6 of the traditional carriers. And then we tend to go over the 3 companies that are pricing the best, i.e. are the least expensive. We have found that that's about where people's focus starts to wane. It's a lot of information in a short period of time, but we want people to understand what's universal, what's unique, right? What's important to one person may not be important to another person. And so we have an individualized, tailored, unique conversation. Once we do that, Then we have a specific process for follow-up, right? So in a week, we touch base. In a couple weeks, we touch base. We realize that this is not fun or exciting and nobody really wants to do it. And so we try to follow up, not be annoying, but follow up and make sure that questions are being answered and decisions are being followed through. Once somebody makes a decision, we have an online portal, which again kind of gets into some of the meatier substance of what the applications are looking for. We'll order any necessary tests. We'll populate the applications, send them over to you for your approval and signatures, and then it goes into the underwriter's hands. Once the carriers have the policies, we have follow up with what are we waiting for, where are you in the process, and then there's an offer. If the offer makes medical sense, right, and it's what we expected, great. If it's not, that gives me the opportunity to advocate on behalf of our clients if I truly believe that it doesn't make medical sense. And I will tell you that we've been successful and we've been unsuccessful, right? And so we try to advocate and push whenever we can. And then kind of there's a discussion with our potential clients. And one of the things that I'm really, really passionate about is follow-up. I was sold my policies and really never heard from my broker again. We touch our clients at least twice a year to make sure that we're doing all the right things. Are we keeping pace with with a growing income? Have you bought a house? Have you had a kid? Has there been a big life change so that we're keeping pace? Because additionally, one of the mistakes I made was not keeping pace with my income. And so when I got hurt, I was really underinsured. And our lives would be a lot different if we were getting what I qualified for when I got hurt. So we make sure that once somebody comes into our company, that we're touching you a lot.
And how long does the process take from first consultation to actually having the disability insurance coverage purchase?
It depends. There are a lot of moving parts. We've had files from start to finish in a couple of weeks, and we've had files take months and months and months. I will tell you that there are two places where we get stuck a lot. One is actually getting a hold of people's group benefits. The way that the traditional carriers will dictate how much coverage you can get outside of training is based on an internal algorithm that looks at how much do you make, what benefits do you have, and who pays for them. And then they give us an answer. It's not like you can say, hey, I want $20,000 of benefit. I'm willing to pay for it. If you don't qualify for it, you don't qualify for it. And they ask for your group benefits. Getting those benefits from HR is sometimes really difficult. Additionally, the carriers will often ask for medical records, and getting physician statements has become a bit of a nightmare. You would think with EMR that it's as quick as pushing a button, but a lot of hospital systems go through a third party and they can take weeks, if not months, to get. Some of the carriers are starting, since COVID, have kind of started to move away from physical records and there's a universal system now that some of the carriers can access. And so it's getting a little bit easier, but we've had files take a really long time. I would say on average, if a client does their part quickly, you can have a policy in 4 weeks, but obviously there's always going to be outliers.
And does your firm also handle life insurance?
We do. While we started really as a disability firm, I realized that so many people that we were speaking to didn't have life insurance. And so we started to make that part of our offering. So every single broker here can talk about disability and life insurance. I'll say that life insurance, not nearly as nuanced as disability insurance. And for 99.9% of physicians, term is really all you need.
That's great. And when is the best time for a physician to apply for disability and life insurance?
So a little bit different for the two. For disability insurance, training is the best time. There are discount programs that exist at most of your training institutions that you can lock in while you're a trainee, so resident or fellow, that we just can't get once you become an attending. The younger you are, the healthier you are, right? All of that factors in. So given my druthers, every intern should be getting covered. The caveat to that is additionally, there are a lot of trainees that, want to try to wait until kind of further along in their training. Absolutely need to get it before graduation, again, because of a lot of those discounts. Women absolutely need to get this stuff in place before the first time they try to get pregnant. The traditional carriers try to find any reason not to cover pregnancy. And I will tell you that pregnancy claims account for about 8 to 10% of claims every year. And so if you've seen reproductive endocrinology and infertility because of infertility, if you've had a miscarriage in the last 12 months, if you've had gestational diabetes, they're going to look for a reason not to cover pregnancy. So for women, I always tell absolutely, if you're thinking about baby making, please get your policy in place. Life insurance, there's a little bigger of a window because we're not looking at discounts. I mean, obviously, the younger you are, the better. Men need it if they have a dependent. Women, again, I recommend getting it before they're pregnant. Things like gestational diabetes and preeclampsia can as much as double to quadruple the cost of life insurance. And so I really urge women to get it before they try to get pregnant. Additionally, if you're somebody who that your parents are going to be, that you're going to want to help take care of your parents, that may be a reason to get your life insurance early. If you have other folks that are dependent on your income, you're going to want to get it sooner rather than later.
And I know that at least in my institution, I went to residency in Northwestern, that during your last year of training, there was like a standard policy you can get without medical underwriting. And that was really necessary for me. Can you speak more about those kind of policies?
Absolutely. So in some institutions, not all, there is something called a guaranteed standard issue policy, or more commonly known as a GSI. Some are through the GME department. Some are just through agents who are local. They tend to be bequeathed to captive agents, meaning agents who work for a specific company, not true brokers who are like Switzerland and can talk to all of them. These are policies that do not require any medical underwriting. So that means they're going to cover you for everything, right? Some of them will have a little caveat that you have to have the policy in place for a year. And so if you do go out in the first year of the policy, there may be some issues. But for people that are potentially hard to insure or have issues that would lead to body parts that wouldn't be covered, or, you may not be able to get covered at all, right? So type 1 diabetics, we can't get traditional policies for. If we can find a guaranteed issue policy, that's amazing. Now, you may say, why wouldn't everyone want to get a guaranteed policy? Most of them will have some place of inferiority, either in the maximum benefit that you can qualify for, right? So right now, all 6 of the carriers will all get you to a maximum benefit of $20,000 a month. A couple have increased over the last 6 months. A lot of the GSI policies may max out at 8,000, 10,000, 12,000, right? So you may not be able to capture the higher limit. Some of them won't have all of the bells and whistles. So some of the riders or pieces that we add to make a total package may not be there. Most of them will have a 2-year limit for mental health and substance abuse coverage, whereas outside of that, you may be able to get covered for the length of the policy. And you have to be really careful. I have also seen a couple of these guaranteed policies actually not be true specialty specific policies. And so you need to be really careful when you're looking at these policies that they have that language. The other inferior pieces, I really don't mind, right? Because something's better than nothing. And we can always try to layer in potentially a non-traditional policy. But if you are somebody who's hard to insure, if you're somebody who, has big issues that are going to make a private policy either more expensive or not complete, those are amazing. And they typically don't really promote them. Sometimes you have to use a little elbow grease and reach out to your GME department, reach out to social media kind of networks for your training program. A lot of the bigger university programs have them. Some of your smaller community programs may or may not.
So if you recommend getting it right when you're in training, would you have a resident come to you their first year residency, see what kind of policy they can get, and then depending on their ability to get one of these guaranteed standard issue policies, potentially switch to that if that's better for them?
Well, sometimes you can get the guaranteed issue policy at any time during your training. Sometimes you have to get it your chief year, right? So right around graduation. So it all comes down to kind of the individual conversation. But again, we pride ourselves in being transparent and leading with education. And so we'll have those conversations.
And then does Pearson-Ravitz only work with physicians or physician spouses, or do you work with anybody?
So we'll work with anybody. Obviously, because I'm a physician, first and foremost, that was kind of where we started our focus. But understanding that not all physicians are married to physicians, we've taken care of everybody. We have lawyers, dentists, veterinarians, teachers. We have somebody at NASA, all the FANG companies. And so we've really we'll take care of anybody. But obviously, because I'm a physician, that's kind of our go-to.
That's great. In closing, what do you want every physician or every listener to know about disability insurance?
You need it. Look, we have been taught since the beginning of time, right, that you need car insurance, health insurance, homeowners insurance. A lot of people have their wedding bands insured. For some reason, getting taught about asset protection just doesn't happen. And you're more likely to become disabled in your working years than you are to die. Yet we all hear about life insurance growing up. And I can tell you that I have seen both sides of the coin. I've seen physicians who have ended up on welfare, who have had to sell their houses. It's horrible, right? I mean, we've worked so hard to get where we are and to do what we planned on doing. And it can all be taken away in minutes. And, look, my story, I'm a bit of a unicorn, but 90% of claims are due to illnesses, and they don't discriminate, right? I mean, cancer can happen to anybody, and other, MS happens a lot. And, I think that there's a little bit of a tyranny of perfection that exists in medicine, right? We're supposed to be stronger than, better than, more resilient than. And at the end of the day, when you get faced with illness or injury, that it all goes away. And the last thing you want to have to worry about is finances, right? And we're all trying to get better about our financial literacy. I feel like this has really been a growing topic in healthcare, in physicians over the last 5 to 10 years. And this is one pillar of financial literacy and risk management, and making sure that our families are taken care of in the event that something happens.
So if someone has a disability insurance policy, can they come to you and get a review and see if that's something that's actually a good policy or something that really should potentially be changed?
Oh, absolutely. We do a ton of audits. And again, going back to being honest and transparent, if you have a good policy, I'm going to tell you have a good policy. If there are holes, then we have to talk about what makes the most sense, right? So it doesn't always make sense to replace a policy or get rid of a policy, right? You may have been happy, healthy, and intact 5 years ago, and now something's happened, and replacing the policy may actually do you a disservice. And I have seen those cases as well, where someone will come to me and say, oh, I had this, but this person told me to replace it. And I'm like, oh, no, you have, and so if it's good, great, that's awesome. If it's not good, then you have to have a pro-con conversation.
And I always talk about finding out how your financial advisors are compensated. So how does that look for you? Is it a flat fee, or are you just paid a commission on any plan that you sell?
So we have an interesting model. We have really tried to do away with the producers selling to sell. And so all of our producers are salaried. Our company is paid by commission by the carriers, because that's just the way it is. But all of our producers are salaried, so they are not incentivized to sell a particular carrier over another carrier. We truly are Switzerland. And as our company does well, our employees do well. So we're really trying to change the model.
That's awesome.
Well, thanks.
So how can people reach out to you to find out more about either you or get a consultation?
So the easiest way is through our website, so PearsonRavitz.com. And there is a link to contact us. Our phone number is 610-658-3251. I am Stephanie at PearsonRavitz. We have a Facebook page. We have a LinkedIn page. I have a personal Facebook page that you can instant message me. Yeah, I'm pretty accessible.
That's awesome. And I'll include all of that in the show notes as well.
Oh, thanks.
Well, thank you so much for being here. I think our audience will gain so much, as I've learned so much from you.
Thank you for having me. I hope that people find this helpful and educational, and I'm here for anybody that needs me.
Thank you. And thanks for listening. If you enjoyed this episode, please subscribe and let me know by leaving a review. It really helps get the word out. And now the disclaimer. I am not a certified financial professional, and this show is really just for your education as well as your entertainment. I'm also a physician, but I'm probably not your physician. So if you need any medical advice, please consult your own physician. Thank you.